Welcome to Physiomedical Learning YouTube channel. Here I am Pallav Biswas, student of Physiotherapy and Rehabilitation Department at Joshua University of Science and Technology. Today we are going to learn about the human clavicle. Here we know the another name of this clavicle is the collarbone. Clavicle is a long and the cylindrical bone. It has the gentle curve. This is the gentle curve, look like the italic letter F. It lies nearly horizontal to the anterior aspect of the body. It extends between the manubrium of the sternum, and acromion of the scapula, and it forms the anterior portion of the shoulder. This shoulder. Now we are going to discuss about the picularities of the clavicle. It is the only long bone that lies horizontally. It has no medullary cavity. It is the first bone to start the ossification, and it is the last bone to complete the ossification. And it has two primary centers of ossification. Now we are talking about the anatomical position and the side determination of the clavicle. This flat acromial end lies laterally, and this rounded sternal end lies medially. This laterally, this medially. Medial 2/3 of the shaft is convex forward, and the lateral 1/3 of the shaft is concave forward. And the medial 2/3 of the shaft present the subclavian groove in its inferior surface. This inferior surface present the subclavian groove. So here the acromial ends laterally, the sternal end medially, shaft convex forward, medial 2/3 and lateral 1/3 concave forward. So we are easily said that is the right side clavicle. In short form, for understanding the different part of the clavicle, this is the lateral end or the acromial end, and this is the medial end or the sternal end. The medial 2/3 of the shaft, it has the four surface: superior surface, inferior surface, anterior surface, posterior surface, and this lateral 1/3 has the two surface. This is anterior border, posterior border, two surface, superior surface, inferior surface. Now we discuss about the muscle attachment of the medial 2/3 of the clavicle. We know it has the four surface. This is anterior surface, this is posterior surface, this is superior surface, this is inferior surface. This anterior surface give origin to the clavicular head of the pectoralis major muscle. And the next, the superior surface, it gives the origin to the sternocleidomastoid muscle. And the next, the posterior surface, this posterior surface gives origin to the sternohyoid muscle. And the last, this inferior surface gives the insertion to the subclavius muscle into the this subclavian group. I forgot to say something. In the subclavian group present a small nutrient foramen. This is the nutrient foramen. You can use it to remember these four muscles easily. To stir subpectoral, first stir means the sternocleidomastoid, and second stir means the sternohyoid, and sub means the subclavius, and pectoral means the pectoralis major. Now the muscle attachment of the lateral 1/3 of the clavicle. We know here present the two surface. This is superior surface and this is inferior surface, and two border. This is anterior border and this is posterior border. Here the anterior border present a deltoid tubercle, and this deltoid tubercle gives origin to the deltoid muscle. This posterior border gives origin to the trapezius muscle. This inferior surface present the conoid tubercle near the posterior border near this this is the conoid tubercle, this near to the posterior border. This conoid tubercle gives attachment to the conoid part of the coracoclavicular ligament, and a line extend from the conoid tubercle is the trapezius line. Here is the trapezius line extend from the conoid tubercle, and this trapezius line gives attachment to the trapezoid part of the coracoclavicular ligament. At last, in this clavicle form the two joint. This acromial end form the acromioclavicular joint, and the sternal end form the sternoclavicular joint.